promotion.
That's a lot of gray hairs. My gray hairs, it like went multiplied by 10 since we started doing this damn show. It's like TMI. What's that they say? TMI sometimes after we clock out of the show. I'm like, that was just too much information. 7:35. Yeah, let's go to the KWM News Zoom room where I think they've already helped themselves to our virtual Rossetti.
But we charge for the tang. That's the key.
Oh, tang.
Yeah.
Yeah.
We stepped up our game.
There you go.
And it's not just orange drink, it's actual tang.
This is the real deal, huh? Yeah. Okay. 7:35, we have our state epidemiologist, Dr. Ann Pobutsky, and, of course, Annette Aguon, who's leading the contact tracing. Good morning, ladies.
Morning.
Morning.
Hi, Annette. How are you doing, Annette?
We're hanging in there.
We are.
How are you?
We're doing okay. I was just thinking about the comments that the birthday boy, Dr. Felix Cabrera, had made to the Mayor's Council of Guam just the other day, Bree. He said
to the Mayor's Council of Guam? I can't even remember.
He said we're losing this battle.
Yeah.
Is what he said. Yeah. Right? Yeah. And then it was funny in one of the chats I'm in, someone said, "Oh, maybe we need to change everyone on the PAG if we're losing the battle." Sorry. I don't want to make it awkward. But if we could, and I guess we'll start with you, Annette. Contact tracing. You guys went in with a rapid engagement team. There was data that showed that the infection rate and the spread with the multi-generational homes was an issue, and I think that
lack of access to healthcare.
And I think with the testing that was done with the RET and that deployment, it kind of showed that data was accurate. Right. So of the positives, if you could, just because it's been so crazy, how much of that is from the RET? How much of it is from contact tracing, maybe prior to the deployment? And then how much is just new COVID? And good morning.
I don't have that breakdown yet.
Right, yeah. Well, just tell us what you can tell us.
Because we also still have to look. Well, we have to still look back about if there are any contact, from previous cases. And again, that was our concern is multi-generational homes, people visiting each other or having gatherings and going back to their respective homes. And so unfortunately, for a high-risk area like Gilboa and Zero Down, with so much stacked against them, for some of us, it wasn't a surprise to see that high number because of the challenges that they have, access to care and crowded living conditions. So, it's, again, it just continues to show that this virus is a big challenge, especially when there's a lot of people who are asymptomatic. But what is more frustrating is those who are symptomatic and still don't heed the messages that we've been putting out for the past 7 to 8 months about staying home, not going out to visit family or friends, or not going to work. We continue to hear that, oh yeah, I've been sick for a few days to a week. I went here, I went there. Or I had people come over to my house, or, we had, even if it was a small gathering, but you knew you were sick and you were still going out or not wearing your mask. Seeing some of the businesses not complying with, as we relax some restrictions, and then seeing certain businesses not complying, that could contribute to our ongoing battle. And again, we're still seeing double digits. We haven't eased up since August.
Yeah.
And so people again are relaxing, letting down their guard. Frustrating.
Yeah, Dr. Ann, let's get you on here because I like it when you talk. Just tell us, we haven't heard from you in a little bit, right? And so, like Dr. Annette, Annette had said, and like we all know, the numbers, this second wave, it went from eyebrow raising to, I feel like it's a tsunami.
This is what my husband said this morning. He said, wow, it's gloomy out there because of the rain. And that's the same assessment for COVID. It's gloomy. Yes, we have not stopped. The surge has not stopped. There was a little dip in September, and then it has not abated. We have just moved our classification. We report to CDC and to the WHO. We've just moved to stage 3 in the WHO assessment, which means large-scale community transmission. which is not good. Stage 2 was low confidence. We were seeing community transmission, but not at the extent that we're seeing now. So yes, the outlook is gloomy. We're worried about, and so is the Physicians Advisory Group, about what's going on at the hospitals. And we're in stage 3, large scale community transmission, mainly because of what we're seeing at the hospitals. There's too many people in the hospitals and the continuing death toll. It's not stopping. And we're going to continue to see this, which means there's widespread community transmission, and it's not stopping. And yes, we understand. Yes, people going to work, having parties and all this. It's like, whatever happened to stay home if you're sick? Call in sick. Don't you have sick leave? You're just spreading the virus around, and it's endangering people who are most at risk. The elderly, people with chronic conditions. We've been saying this for 8 months. And yes, I know the governor is trying to open things up, and she's trying to ease things in and out, and you know, but people, again, it's back to, remember Dr. Jana Manglonia saying, the community, it's not public health. Like, it's all, let's blame public health for the community transmission. We can only do so much, and we're actually enhancing our capacity. We're hiring people. We've got a CDC deployment team out here right now helping us. We're expanding the contact tracing, et cetera, and we're getting more staff to hopefully to help us with the data, with the contact tracing, with the case investigation. We can't stop something that's, you know, just out of control.
Right. Yeah.
Dr. N, how many stages are there? You said we were at stage 3?
I don't know. I think there's 4. They keep asking me, "What are you at this stage?" And I just reply, I guess I would have to Google that. And
yeah, I saw.
You want me to
chart,
do it right now?
We saw a chart. Someone has sent us that it said that Guam was at that widespread stage of just rampant community transmission. That being said, Doc, what do we do? I mean, I think there was a sense of people maybe had a little relief when we found out, oh, we're going to be getting these nurses from the temporary solution,
Staffing solutions,
right? And DOD's got these tents. So I think there was this false sense of we can handle what's coming, but obviously we can't. So we can't control something.
And it really is. We're back to the same message about it's not just individual responsibility about wearing a mask, but it's about the community taking, following the rules. Last night I saw a group at Epan Beach. They were, just 2 feet away from each other, no masks, having their after work pauhana right around a pickup truck. It's like, just because you haven't seen your cousin in a while doesn't mean you should expect everybody's got it. Wear a mask, social distance, don't have parties. We're back to the same message. And what we're seeing now, there is a lot. The Physicians Advisory Group was talking about this last night. There's not a lot we can do about households, because you're in a household with your family and people who live there, and there's not much we can do about, we found a case where 10 people in the house, 9 of them tested positive up in Jigu. But we can do something about the between household transmission. That means, don't have parties, don't have birthday parties, don't have a wedding, forget the funeral, just bury your dead. This is a pandemic. It's not going to stop. And what are you going to do if you get sick and the hospitals are clogged and you can't get seen? That's happening in the U.S. Mm-hmm. Or do we want to see that happen here? Do we really want to see tent hospitals? You go out to GMH and there's a tent city and it's raining and you have to be put on a ventilator? Not a good scenario. So it's likely that the governor is going to impose additional restrictions. I don't know what those are.
That's what you're hearing?
They're going to lock everything down again, but they're going to probably try some other things to get people to pay attention again.
Right.
Is that what you're hearing from the meeting last night? That more restrictions were going to be coming down?
Yes, but they have to confer with the governor, and she gets to decide. So we don't know exactly what those restrictions may be. I don't know.
Did she participate in the meeting
details
last night? Or just a representative?
I'm sorry?
Did she participate in the meeting last night, the PAG meeting, or was it just a representative?
Yes, I participate with all their meetings.
The governor, did she participate?
No, they confer and they talk to her the next day. They confer with her every day.
I wanted to get your reaction. The Guam Visitors Bureau, they met yesterday, and some of the things that the GVB vice president said was that the current test and tracing strategy for containing COVID is not making any significant impact. And then there was also something that he said regarding a GVB employee that was, not sure if he was in isolation or on home quarantine, but he did say that the contact tracer had no idea what the COVID alert app was. Do you have?
I don't know. I'm not in charge of contact tracing.
Oh, that's
Annette, you
you.
want to answer that?
Yeah.
I don't know about that statement.
Yeah.
But again, we are hiring people to help us. But the contact tracing app is for those who don't know if they're exposed or anything. If
Right.
you're already identified as a contact, you've been identified. We know you're a close contact. So the app is for the people who don't know if they've been exposed. So if a contact tracer is reaching out to you, you've been identified as a close contact. And so now you will be put onto the monitoring, the daily check through our monitoring unit for identified close contacts for those who are people who are placed under quarantine.
Yeah.
In regards to what the vice president announced, I would have to respectfully disagree. Our testing identified all these cases. It is not taking us 3 days to turn around. We get results the same day. We've expanded our capacity to numerous private partners in the community with the Abbott testing. We've went from 1 testing platform to 3 testing platforms over the course of this outbreak. And again, this is a novel virus, so no one had the testing capacity at the onset until the various platforms were created and approved by FDA, be it through the emergency use authorization, the EUA. So going from nothing to 3 testing platforms, I think we've done a great job. Our staff are running long days to have turnaround within the same day. If you get tested at Dedido Public Health, the results are that day. So we are not getting 3 days turnaround time. We are getting same day turnaround time.
Right.
Our staff are pulling long hours. They're not getting off until 11 or at night, midnight, just to make sure there are no pending specimens for the next day. And we are utilizing all 3 testing platforms to ensure that we are not having any backlog of tests.
So in other words,
again,
GVB, stay in your lane.
You said that, but yeah, I mean, again, I'm not the one on the tourism or for, the economic side. I can only speak for my part in public health.
Right.
In regards to testing. I'm not the expert. I would defer over to my lab administrator with our microbiologist and the CDC microbiologist that we have here. We reach back to our experts, subject matter experts too in the States. We have that great network where we can consult with them, because there have been so many recommendations over the course of this response about the various tests that come out.
Right.
Antigen, saliva, the PCR. PCR may be slower, but it's the gold standard. Saliva, everyone was already asking us when the news came out, but that wasn't meant for mass production and for distribution. So we put in our request, we don't have it.
Yeah.
Antigen, there's so many different kinds. And so there's other things that are needed, not just about the quick turnaround time. We're looking at the actual accuracy, the sensitivity. And so, and also the capacity. You're going to have various tests there, but do you have the human resources to do it? And also, I know he mentioned something about, the self-testing. How many people are comfortable if it's a self-test that requires a nasal swab? Are you comfortable putting that up your nose by yourself?
I wasn't
Are
even
you sure
comfortable
you're
when the
hitting right
clinic did
spot?
it. Yeah,
I'm
yeah,
sorry?
and that I wasn't even comfortable when the clinic did the swab. But yeah, this clearly is. I mean, I don't like it when you apologize for speaking from the public health standpoint, because this is a public health emergency. We're in a pandemic, and everybody's got their 2 cents about how we should be running things. But I mean, we get you guys in here all the time. I know you're working hard, and to me, this is just so random and so out of left field that I just got to say, I mean, GVB, you're not the experts. You know what I mean? And I don't know. We've seen this from time to time during this pandemic, where you get somebody with, political connections pop up and be like, I got these tests. We should do these tests. And this, to me, it just seems like the same kind of thing. So I know you guys are working hard.
Right, but I think GVB also is presenting a plan to augment the strategy we're using, which, according to Dr. Cabrera, said clearly we are losing this fight right now.
Right, but is us losing this fight, Annette and Dr. Ann, does it have anything to do with the kind of tests that we're using, or is it just that people are not listening? They're not staying home. I mean, it's clear
We
they're
have a
not.
really good testing capacity. It's people's behavior. We're back to people's behavior. The physicians group was talking. They always talk about the patients they're seeing as well. And these people are talking about, oh, I was at a birthday party. I was at a funeral. I was at da-da-da. Why are people having get-togethers? Because we're social creatures. Humans are social creatures. What they were talking about last night is that all the things that make Guam great are liabilities in a pandemic, because we are social. You know, the fiestas, the parties, the christenings, you know, all of it. And it's hard because people also, we're social creatures. We want to be with other people and visit our friends. But unfortunately, that's the way this virus spreads. It's a respiratory virus. So again, we're back to, oh, I haven't seen you in so long and nobody's wearing a mask. It's like, just assume everybody's got it. There's a new definition out even now from the CDC on what is a close contact. And if you want, you can Google that. I'm not going to go through the details, but I was making a joke about it. It's like, really? That's the CDC's new definition of a close contact? You've been within 15, more than 15 minutes in a certain period. So that means everybody at the post office has been exposed. But they're doing better at the post office. They have more people, so the line is not as long. But at one point, you had a 2-hour wait at any of the post offices just to mail a package or pick up a package. And people might have been 4 feet apart. Everybody's wearing a mask, but you should just assume that it's out there. So wear your mask, social distance, wash your hands, and don't have parties and get-togethers. Forget Christmas. Forget Thanksgiving. Just do it with your household.
Doc, I'm ready with you. I told my kids.
They're also predicting a really gloomy outlook for the U.S. They're saying this is the worst outlook now because everybody's going to be inside because it's winter there. Well, it's raining here. People are stuck inside. Well, try and keep your household intact and don't have these get-togethers. Bottom line.
Yeah, bottom line, you're right. So we're getting Dr. Ho on this morning, and he was messaging me last night. Funerals, birthday parties, and weddings have outbreaks at this time. Please pass the word. And I said, hey, can you come on tomorrow? He said, I'm mad, but yes.
Okay.
What about for places like I'll just say McCrowd's, that they're just admonished. There's no enforcement. I guess armed to these executive orders to be able to shut down businesses that are violating these executive orders and public health guidelines, and we're still waiting for this Attorney General's opinion. So what is, I guess, Dr. Ann, your thoughts about legislation that would punish COVID violators?
Well, I don't know if legislation is needed. I think public health does have the ability to do some kinds of fines for people who are but I don't know the exact rules on that. Yeah. So that's something that you might know.
Yeah, we actually need more as a deterrence so that people will comply. Yeah. I know our public health, there is no public health police out there. There have been a lot of talk about, look at Hawaii, make the fines higher. They're like 5,000. They've arrested individuals who have not complied. And that's helped kind of beat back the spread because they were having another spike themselves. Right. And so that's something that there are various suggestions out there. There's even something about let's them, give the power to our mayors. They know their people. They know their area. Similar to what they do for, writing out speeding tickets. The mayors have offered their help from the beginning. They're standing with us. They want to do more. And so let's empower them and have them help us because, yes, we can't do it. Our Division of Environmental Health does not have enough manpower for all these establishments and all these, reported violators. So we do need that help. So anything that can help as a deterrence to remind people about behavioral change, as we keep mentioning, to enforce what we put out there. Again, we have all the guidance, we have the executive orders out there, we have all our education materials, but if people are going to knowingly violate what we put out or not even care about it, and then we see this on video of different establishments, no mask, there's no social distancing, every table is filled, they're elbow to elbow. and then public health is going to be blamed for we can't stop the spread. We're hearing this information 1 to 2 days after it happens already. That's if you're exposed, you brought it back home. You took it to your work. You're already you're possibly dealing with the exposure and developing the illness. Because you went there or you didn't wear your mask.
Yeah.
So yes, for me, it's we have to be more strict. We have to, unfortunately, there has to be people who pay the consequences so other people know this is not a joke. We've been doing this for 8 months. We want to bring the numbers down. We want to get back to how we were in, was it April or May, right, Doc? Where some days we had 0 positive cases, new cases. That's what we want. And then safely and slowly reopen our island. We need that tourism boost, definitely, because after all this COVID money is spent by end of December, then what? So that's what we really need to work hard as a community to bring the numbers down so we can open up. I mean, GVB is talking about, let's look for January. They had to push back because our numbers went up. And so we don't want to continue to delay that because we do need the economy to open back up so that, we can stabilize. And we're talking long term, right? This effect of the epidemic and pandemic would take us 1 year to 2 years to recover. So the sooner we can reopen up safely, the better we can start, rebuilding our economy.
Yeah, it's frustrating because it's these same people who are clamoring about their constitutional rights and being able to open their bar or whatever. It's the reckless behavior of these establishments that's prolonging this spread of the virus, and it's keeping the island closed. And I just feel like it's become almost like a nanny boo-boo. Like in the case of McCrouds, they've been down there every weekend, and they get admonished. So what does that tell all the other businesses? Oh, you better obey those protocols, or you're going to get a good talking to.
Right.
Right, but at the same
And,
time, I don't understand why we are waiting for an attorney general's opinion on enforcement, or whether or not we can shut places down, when you would think that we would have had that before we started putting out these executive orders saying all of this stuff that you can and can't do.
Yeah, I agree with Dr. Ann. I think public health does have the authority. I think they got sued a couple times and it made them gun shy.
And in the beginning, when we had all these executive orders and guidance memos, our community they complied. Yes, there were some grumbling and complaints, but as a whole, our community stepped up and did their part. But just reading to some things coming out from CDC and national news about now we're dealing with pandemic fatigue, right? It's been dragging on so long that now people are just like, we're tired, we're tired of being quarantined, we're tired of all these restrictions. But again, it's an up and down battle. I know Dr. Ann has mentioned this early on that, we're going to have wave after wave. And so unfortunately it's open up, lockdown, open up, stay at home, open up again and safer at home. And again, it's just a constant until we either get the vaccine out here or we get some medication to prevent it and treat it.
That's the plan, open and close?
Unfortunately, that's
the pattern. That's the pattern. For example, when schools open up, you're going to see a surge. The spike we just saw recently in our Micronesian community, that's expected. They're part of the island. But people kept focusing on, it's this ethnicity. No, it has nothing to do with ethnicity. It has to do with their living conditions. Let's talk about socioeconomic status and what are their living conditions that might make it more conducive. So that was expected as well. It was expected once it got into the Micronesian community. And we're working with them. We've been working with them since August. And there's now their numbers are equal to the Filipinos and Chamorros. So it's like, it's equal blame all around for everybody getting. It's all ethnicities, all ages. Yeah.
Since we have you on
the
phone,
problem is the old people and the sick people end up in the hospital, and a lot of them die. So we don't want to see that. Again, we talked about this. We've been talking about this every week.
I know, and it's frustrating that our people complied with the orders when the threat of dying and the threat of the spread of the virus wasn't as great as it is now. That's what I don't get. It's like, man, we were doing good in the first wave, and maybe that's why we saw that wave end. And now that things are really bad, everyone wants to run around and just ignore I don't get it, people. It's bad now. This is the time where we really got to just hunker down, and it's a long game, right? It's a long game. We hunker down, we bite the bullet, we suck it up, and then maybe we come out on the other side better for it. It's pretty simple to me. I don't understand. It's very simple.
Actually, going back to what you said earlier, Chris, about people have that sense of security or false sense of security because we're bringing in off-island help, those temporary nurses, and we're going to put up some tents. That actually should be an alarm, not
Right.
something to
Yeah.
feel comfort. It's alarming. You don't want to have that here on Guam. You don't want to see these hospital tents going up. That should be the reverse message to you, that you want to avoid that coming to Guam, because that means our hospital, our healthcare system is overwhelmed. Now we have to go get help from off island. It's not a sense of, okay, we're good and we can relax. No, it's more alarming because that shows that we need outside assistance. And normally with Guam, we're resilient people. We can take care of each other. We help each other across, be it private or government, the community, faith-based. But to have to get off-island assistance, that should be an alarm for people, should be very concerning. And to actually increase your sense of urgency to protect yourself and your loved ones, not to relax. It should be the opposite
Right.
effect.
Good point, Annette. I mean, imagine if we didn't get these nurses. I mean, imagine if we didn't get the DOD. I mean, oh my God. We're up against the top of the hour.
I just,
Go ahead.
before you let them go, I did want to ask about, Annette, have you heard anything about a bakery that had seen an alarming number of positive cases? Because I heard about this bakery, and this bakery has not shut down or has not done anything. It just remained open.
If people have concerns of any business or establishment, please report it to us. I can't confirm or deny that, but I can tell you this: we're hearing it across any and all types of establishments, and that's what's alarming, is it just keeps spreading out there. And again, going back to those gatherings, going home, now going to your respective job, and this virus does not discriminate the type of business you work at. So again, like Dr. Ann mentioned, just think everywhere is high risk. But if there is any concern of an increase in a number of employees, we work with that business. We reach across to our Division of Environmental Health to go and look into that as well, because they are the ones that are the regulatory and the enforcement side of for us, especially if it's a health regulated establishment, that they can go in there and check, okay, are you complying with all the different guidance that was put forth and the requirements, like what they do for their sanitary permits and their inspection. So they can do definitely a site assessment, and then we work with the owners. And again, the majority of the owners have been great. They've really stepped up, even if they don't have a case. And that's what we want to continue to see. We want to provide guidance. Maybe there's some assistance we need to give to some establishments. And we've had some reach out saying, I just want to make sure we're doing it right, or is it enough? And so, that's something that we collaborate with internally. We have our infection control experts. Chima is who we turn to in various partners and private sector to make sure that what they're putting in place is correct, and what they're following and continue to do, is the right thing, and not having that false sense of, okay, yeah, we're good, so they can relax a little.
Right. Top of the hour, I guess, closing message. We'll go ahead and start with you, Dr. Ann.
I don't have anything else to say.
Right. I'm just
Stay
looking
home.
at this CDC thing, Dr. Ann. Are you talking about the risk assessment level? Is that we're at level 3 now? What's the title of that designation?
That's the WHO designation.
Okay.
I don't have it in front of me, but they keep tabs on what's going on here, and they ask me, are we moving from stage 1 to 2, stage 2 to 3? And it's like, at this point, yeah, we're at stage 3, which is widespread or large scale community transmission, unfortunately.
Okay, we'll go ahead and look that up. Annette, I mean, you're seeing the connections between all these cases. You've got a really good look at the lay of the land with the virus. What's your message as people head into this weekend where we're going to see more gatherings?
get your flu shot. It is that time of the year for us,
Yep.
right? So get your flu shot. Stay home if you're sick. Please stay
Yep.
home. But if
Yep.
you are sick, don't wait too long to go seek medical care. Call your primary doctor and get some guidance. And that's the other thing that's alarming is we're seeing through our partners at GMH who, report out to us, people are coming in, be it by personal vehicle or by ambulance, and they've been sick for how many days that they're waiting until shortness of breath.
Yeah. Yep.
Don't wait that long because
So
then
for people with chronic conditions, or the elderly, pay attention. If you have a chronic condition, you need to manage it. That means you need to see your doctor if you start to feel really sick.
Yeah. And the private doctors have been stepping up. They've been putting out a message too, and they've been helping, and so that's something too that go to your private doctor so that you don't further overwhelm the hospitals. Let them take care of their severely ill. But if you start to have symptoms, take it seriously, and so that you can get medical care if needed. Consult with your doctor. The whole big thing with telehealth or by phone call. And then from there, the medical experts can further guide you and give you recommendations what you can do to help take care of yourself and not need to go to GMH, if it's not necessary. And so again, don't wait. All the safety precautions: cover your cough, wash your hands, wear your mask, stay home. Please stay home. And tell others to do the same thing. And if you know that they're not complying, your family or friends or your loved ones, please remind them. Help us to remind them, since you can see it right there and happening in front of you, that we need your help to do that as well.
And take care of your family. This is not just the flu or a cold. This is a deadly coronavirus. It's nasty. Take care of your families. Be safe.
Be safe.
Thank you.
Grab you some virtual Roschetti. It's been sanitized and packaged individually for you guys to take away from the KUAM News virtual Zoom room.
Thank you.
I feel like Dr. Annette's going to go put it out in the sun for a week before she touches it. Safety first. Thank you, Dr. Annette. Thank you so much for your time.
Sure.
Okay, wash your hands and stay home and be safe. God bless you. 807. We're KUAM FM and Annette Aguon. To our viewers on KUAM TV. I know we ran a little over, but just the importance of getting that info out to our viewers there, as we got a lot of Manomku who watch the show with us on KUAM TV, the first half of the show. There's a whole day of great programming coming up on KUAM TV. My name is Chris.
I'm Sabrina.
Thank you again. You guys can jump over. We're on the radio, The Breeze, 93.9 KUAM FM, and we're also on our KUAM News Facebook Live feed. So to our viewers on KUAM TV land, esta, adios. We're back. We got